Hey guys, Dr. Ben here at Will Centers. Let's go over some questions today. Go ahead and bring whatever you've got. Anything, obviously health related is preferable, but whatever. I'll answer questions about anything as long as it's acceptable to the social media world. So welcome, love having you guys on. Pop down below where you're watching from and where you're asking those questions from, and just give me as much as you can. You've got this issue going on, you've got this problem, your loved one does, you don't know what to do next, you're confused, you've been told certain things by your medical professional. Whatever it is, bring those questions today. This is your time, the next 30 minutes. I am all yours. And Olivia, good to see you there in Castellan Springs. Not sure where that is, but welcome. Thanks for jumping on. So, hey, there we go, Samantha. Some of the things, can you post a link to your books? Yes, Brittany, go ahead and pop those down there. So I have two books. I have a blood sugar book called Blood Sugar Doesn't Lie, and the other book is Rebuild Your Brain. And that was my first book, and it's basically the first half is about what damages your brain, and the second half is what you do to fix it. So it's Rebuild Your Brain, stop the damage, start the repair, because we can't just take a bunch of supplements and we're going to fix our brain. And we can't just go, ooh, we're going to stop doing this one thing, but we're not going to do anything to actually fix it. So we've got to stop damaging, start rebuilding, and that's how we focus on helping people's brains. And then on the blood sugar, I call it Blood Sugar Doesn't Lie, because blood sugar doesn't lie. If you see your blood sugar, if you poke your finger, your blood sugar goes up to 180 and I don't want it over 110, guess what? That is a problem. That is not a good food. You need to do something different. We always say do more of the good stuff, less of the bad stuff, and you will see major changes. Hey, Barb in Scottsbluff, great to see you. Have you been up hiking the monument lately? It's a nice time of year to do that, except it's probably a little windy out there like we are here. So some of the questions that we've been having this week from people all over the world are things about COVID long haul. We've been doing some research, posting some things, and there's a lot of different things that people are asking, why is my hair falling out? Why can I still not smell? Why do I have neurologic symptoms? A lot of different things. And what we're seeing is that it's definitely an inflammatory process. I was just reading an article today that a study published in Nature magazine, and they were looking at this process of the cytokine storm. So people that had extreme cases of COVID and had to go on ventilators and shredded their lungs, all those things, this cytokine storm just blew through, and this inflammatory process was started. But here's the deal: even if somebody didn't go on a ventilator, even if somebody didn't have a lung issue, then they absolutely could still have a cytokine storm started, and they could have had this inflammatory process. We're seeing a lot of patients that their autoimmune either was reactivated and they were doing really well. It was either reactivated or they got a new autoimmune condition by having COVID or getting their shots. And so something about that spike protein is driving this immune inflammatory cascade. So again, love having you guys on. Pop down any questions you have below, anything health related. Again, when we're asking these questions, I'm going to respond from a place of what's the underlying why. And that's really what functional medicine is all about, is why is the body going haywire? And that's what we look. So here's a question a lot of people get is, what are the blood work markers I should get in my current blood tests that I'm getting run? And here's the top 5 that you need to be doing. You need to be running a ferritin. You need to be running a non-fasting insulin. So you need to have eaten that day and run an insulin. You need to be running your A1C. You need to be running a GGT, which is going to tell us about potential fatty liver, and then even running some inflammatory markers like CRP, homocysteine. Some inflammatory markers are really, really good as well. All right, here we go. Olivia, diverticulitis and fibroids. I'm currently battling both. What causes these? I have lupus and fibromyalgia, and it seems like everything is worse. So here's the deal. Every one of those things you're talking about, Olivia, the diverticulitis, the fibroids, the fibromyalgia, the lupus, these are all, what do they have in common? These are all inflammatory based conditions. Diverticulitis, itis, that's inflammation. You have inflammation in your digestive tract. The fibroids, I'm assuming they're uterine fibroids, your uterus and your hormonal system is inflamed and having a major inflammatory process in there. Lupus is an autoimmune condition. This is a inflammation-based process where the body is going haywire and attacking itself. The fibromyalgia is inflammatory. You have muscle pains throughout your body, not because you worked out too much, but because you're in a total inflammatory state. So here's what you do, Olivia. You've got to get to the underlying why. You've got to fix why you have inflammation. So that's where the blood work comes into play, and you've got to do an in-depth, throw the net wide, and figure out what's going on. You've got to look and see if your blood sugar is out of balance. Absolutely. Every time it's swinging up too high, down too low, you're going to drive that inflammatory process. And that blood sugar, it's also going to cause PCOS. It's going to cause hormonal imbalances. It's going to drive autoimmune in your lupus every time it goes up too high and down too low. Fibromyalgia, a lot of times that's a sleep issue. If your blood sugar is not stabilized, you're not going to get the deep quality sleep. You need to look at adrenals. You need to look at thyroid. You need to look at small intestine, leaky gut, your vitamin D levels, all of these different things. You've got to take that step back, and then you've got to start moving your feet and getting that inflammation down step by step by step. So whatever you're doing right now, it's not working. And so you've got to get more in depth, get more information, and figure that out. If you need help, drop us a line. Alicia, what can someone do about a flare-up of seasonal allergies, medicines to take? Brittany, you can pop the DHIST, a link to that from our website on there. But there are natural antihistamines that are helpful, but ultimately, just like we were talking about, the seasonal allergies, they're made worse by inflammatory processes in the body. What we know is that when people are getting their inflammation down and getting their bodies better, they are able to handle way more on the seasonal allergy side. It's less problematic. They get less sneezing, coughing, whatever the symptoms are. So you've got to look at not just the seasonal allergies. Sure, I would love to just sell you a bottle of a pill that's going to decrease your histamine response. It's going to decrease your allergies, but it's only going to be so effective if you're not fixing. It's kind of like this. I always say you can't out supplement a poor immune system. So people are always like, ooh, what should I take so I don't get sick? Or what should I take when I get sick? Oh, zinc and vitamin C and vitamin D and NAC and quercetin. And do I take hydroxychloroquine? All these, whatever it is. Here's the deal. If somebody's immune system is very depleted and they already have, they're not sleeping well, and their blood sugar's out of balance, and their gut's off, and their immune system's depleted, all those things, just taking a bunch of supplements isn't going to fix it. So you've got to take a step back and go, which systems are out of balance that's causing that body to be more inflamed and more reactive. Hope that helps. So you've got to start taking that step there. Which digestive enzymes are related to leaky gut? So actually, and we're posting one of our green posts in the next couple of days, right, Brittany? As far as what to do for leaky gut. And it's actually 2 types of enzymes that are helpful. And it could even be 3. But the first one is going to be stomach acid, betaine hydrochloride. Betaine hydrochloride is the precursor to the stomach acid. And we need enough acid in our stomach. Most people are actually stomach acid depleted as we are under stress and as we age. Give me a thumbs up, any of you guys aging or stressing out there. So as you age or as you stress, we're going to see less stomach acid production. So most people, if you're getting reflux, indigestion, heartburn, anything like that, it's because you're actually not producing enough stomach acid. And as you're stressed, your body can do two things. It can do fight or flight, or it can rest and digest. But if it's mostly fight or flight, it's not going to be resting and digesting and making enough stomach acid. So if you're eating on the run, if you're stressed, if you're go, 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 you're not making enough stomach acid or enzymes, but especially stomach acid. So you need to calm down and get your body relaxed. You may need to take some apple cider vinegar. You may need to take, Brittany, you can put the stomach support link down below from our website. It's a betaine hydrochloride that we use with patients specifically. So those are all going to be helpful. Number two is going to be, as we just go from north to south, is going to be bile. And so for some people that they've lost their gallbladder due to surgery or various things, or they're just not making enough bile, then you may need some bile salts to help break down the fats and to be taken with fatty meals. So, and again, all of this affects leaky gut, because if you're not breaking foods down, by the time it gets to that irritated, damaged part of the small intestine lining and you're absorbing it into the bloodstream too soon, immune system goes up, autoimmune goes up, inflammatory process goes up, all these cascades from having that leaky gut. Number three would be the digestive enzymes themselves, and we've got a great one as well, Brittany. You can pop that one in there also. And so digestive support can be stomach, can be gallbladder, and can be enzymes, specifically pancreatic, small intestine. As you get into that part of the digestive tract, you need enzymes in there as well, and those aren't produced like they need to sometimes. Various reasons why we will be deficient in those. So absolutely, you can take support, and that's going to be one of the 5 R's that we like to look at. This is Connie. Is there a blood test for disorders of the pituitary glands to see if it is working? So here's the deal. One of the best ones to see, because there's 2 things on the pituitary. Sometimes you could have like a full-blown pituitary tumor, some things where people have to take long-term hormones, things like that. That's a totally different story. What we're looking at is functional imbalances of the pituitary. The number one way you can see this is if your thyroid markers, T3, T4, free T3, free T4, are low, if your thyroid hormones are low, but so is your TSH. If your TSH is less than 1.8, and your T3 and T4 are low, less than 1.2, less than 7, less than 3, less than 1.2 on those markers, then we know that the pituitary is whipping the horse to run faster, which is TSH. We know if the jockey is not whipping the horse as fast as it can go, even though the horse is running slow, then the jockey has a problem. And that's usually related to the adrenal gland. So the pituitary tells the thyroid what to do. It tells the adrenals and the male and female hormonal system what to do. So if we see low TSH and low thyroid hormone, that is one of the best ways you can tell if the pituitary is not working as well as it should. Carolyn, what is a good natural alternative for Sjogren's dry mouth? I don't want to take that other stuff. It causes problems, the doctor said. Okay, so here's the first thing. Sjogren's is an autoimmune condition. So if you haven't fixed the why, if you haven't calmed down that autoimmune, if you're still attacking those cells in your mouth that are producing saliva and the different fluids in your mouth, then no amount of drug, no amount of supplement is going to fix this. So you've got to calm down that autoimmune reaction. You've got to get this working as well as possible. So if not, then you're barely covering it up and band-aiding the issue. So Sjogren's, you need to use some things that are actually going to stimulate saliva production, get that going. So some people will put a little bit of lemon juice or apple cider vinegar, anything that's going to help stimulate saliva production in your mouth. If you have Sjogren's in your eyes, I like to come in and do a mild basically think about milking on the top eyelid and then on the bottom eyelid. And if you do that, you'll be like, holy cow, my eyes is so much more liquid and has so much more lubrication on it. Do it one side and compare it to the other, and you're like, holy cow, this one feels like grainy and everything else. So those are two things you can do for that one. So again, keep bringing your questions. Love them, guys. Keep those going, anything and everything. And we've still got time. Keep hitting those. If you're watching this later and it's not live, ask them. We keep an eye on these, and we'll keep posting. Also, if you have not followed us on Facebook, hit that like or follow button. Also, if you're not getting reminded when we go live, hit the little bell up there. It'll ding. It'll tell you when we go live. Try to get that Monday through Thursday every morning. And then on YouTube, if you have not subscribed yet, subscribe to our YouTube channel. Brittany was just telling me we're almost at 700 videos on YouTube, and you can search those. So as opposed to Facebook, where if you want to look up Hashimoto's or you want to look up leaky gut, any of these things, it's hard to find. On YouTube, go to our YouTube channel. Brittany, pop that down below. Go to the YouTube channel, and you can put in leaky gut, and you can find all of our videos. And there, who knows, there might be 10, 15 videos on leaky gut on there, all types of different information related to that. So you can search YouTube in there. If you're not on Facebook, YouTube, we go live on there as well. So you will see us every time, and then we go back and post all of these videos on YouTube as well. So Andrea, it is common to have joint pain months after COVID. Is it? I'm assuming. If so, what can you do about it? So joint pain after COVID. So here's the big concern that you've got to rule out. You need to run a rheumatoid factor, and you need to run a CCCP and then a CRP, C-reactive protein. You need to check to see if rheumatoid arthritis was revved up. You need to run an ANA, which is going to tell us about lupus or mixed connective tissue disorder, to see if you actually had an autoimmune condition stimulated by COVID. We're seeing this all the time, just like the research article I was just reading in Nature magazine this morning. And they were talking about the cytokine storm and this inflammatory process that's driven, and that those cells, once they get that virus in there, can actually replicate inside of the cell and cause lots of different issues in there. And so somehow, some way, an inflammatory process has been started in your body, and you've got to calm it down. So you've got to do everything in your power to calm that down. So you've got to run that blood work, you've got to run your ferritin, you've got to run your inflammatory markers, your hormones, stabilize your blood sugar, all of these different things. But absolutely, you can do something about it, and you can calm down that immune inflammatory cascade. One, rule out autoimmune. Number two, calm that inflammation down. So I hope you start feeling better there. If you need help on that one, because it's complicated, give us a holler. If someone is seeing an improvement in their normal core body temperature after increasing their vitamin D and starting to take zinc regularly, could that be related to either of those? It could be. One of the common things that we'll see for core temperature is actually thyroid. So, maybe taking the vitamin D helps modulate that autoimmune reactions. And for the majority of people that have thyroid issues, it's actually Hashimoto's, which is autoimmune thyroid. And so you may, by taking that vitamin D, getting it up, hopefully you're up into the 60 to 80 range, that may, if you do have Hashimoto's, that may have modulated that immune response and helped calm that down. If that's all you've changed, maybe, but I'm assuming if you're taking those supplements, you're probably paying a little bit better attention to your diet and doing a few different things. And so you're probably calming down this inflammatory state, and that thyroid is probably working better. This is Kelly, I think, or Sally. Is it true nuts are inflammatory and can affect people with immune problems? So for some people, yes. It's not a blanket statement. Nuts are not just bad in general, but one of the things that we do if we're working with a patient, they've got autoimmune or leaky gut, any of that, we do that AIP, autoimmune protocol type diet, where you take out nuts, seeds, nightshades, legumes, all the beans, peanuts, all those type of things. and for at least a couple of weeks and calm down that gut, calm down that inflammatory process. So one of the things I see too is when we've brought foods out and then we start bringing things back in, and people, when they add nuts in, almost every single time if somebody plateaus on their weight loss, if they're going down, 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 and then they plateau, almost every time they've added nuts into their diet. And whether it's just more calories or whether it's because it is stimulating more of an immune inflammatory cascade, not always sure, but a lot of people way overdo it on nuts. And my question is, why are you sitting there eating a bunch of nuts in general? And so a lot of people, they'll be snacking on them. Maybe you put a few almonds on your salads and things like that, and that's fine. But if somebody is sitting there snacking on nuts all day long, you gotta ask yourself, why am I needing this? Why am I needing these snacks? I should be able to sustain my blood sugar throughout that morning, throughout that afternoon. You didn't eat something correctly. All right, good question. Sharon, I have my onboarding. All right, good to see you. Got your onboarding with one of our nutritionists at F8, really concerned about lowering estradiol. As my breast cancer 16 years ago was estrogen positive. Will this be addressed? Absolutely. So welcome aboard, Sharon. So excited to have you on the team. We're going to do everything we can, again, especially to get that estrogen down and make sure that's in a good range. So here's the deal. You can't go in and specifically, you can, but what we don't go in and specifically say, hey, let's raise your estrogen, let's raise your testosterone, let's lower your estrogen, and give you specific supplements or drugs or hormones, anything like that for those. Hormones are either high or low, secondary to other things, and you've got to address those other things more importantly than just trying to take a supplement, because there's certain things, and our nutritionist will probably, and the doctor will come up with a game plan to lower that, even with some supplementation. But here's the deal: if your liver is not processing out like it's supposed to, and the liver changes these things from a insoluble to water soluble form. Once it's water soluble, then we can excrete it. But if it's not in that water soluble form, you cannot excrete that estrogen like you need to. So you've got to be able to convert that over so we can excrete it, but then your gut has to be in the right place, because we package it up, it goes into the gut. If the gut has dysbiosis, if that microbiome is out of balance, if it's slow movement through, that estrogen can pop out of that package and then get back into the bloodstream and have more estrogen in there. So we have to make sure the liver's working well, make sure the gut's working well, do all of these things to make sure you're eliminating like you need to. Kind of like my brain book, Stop the Damage, Start the Repair. You got to make sure that you're not getting excess estrogen into the body, but you also have to make sure you're excreting it out. And then we can work on some specific nutritionals for that. So Sharon, welcome aboard. Great question. We look forward to seeing over those next 6 months, you having phenomenal results and just getting your body totally in balance. So welcome aboard. So Carolyn, the white tongue might be the dry mouth. Yes. So some people, if they're snoring at night, if they're mouth breathers, things like that, they definitely can do that. If you've got Sjogren's, it could be drying that out. Hey Judy, great to see you. Sherry, good to see you as well. Jamie in Fremont, good to see you. This is Gail. After COVID in August, I've had to take more enzymes for digestion after meals. We've seen so many. Check out our post, Brittany. Maybe put a link to that one. We had a post earlier this week of different symptoms post-COVID, and what was there, 300-400 comments on that one? All types of different things that we're seeing with patients and with different people around the world. Digestion, yes. So two things. One, you might be in more of a fight or flight. So It might be a brain thing, and getting a brain map would be really good to see, are you in this fight or flight, and it's keeping you out of this resting and digesting. It could also be that that's part of what the inflammation hit was your digestive tract, and you need to do some healing, do some things through there. But yes, absolutely, we have seen so many symptoms post-COVID. Start drinking kombucha. This is Mindy, and eating kimchi and sauerkraut to help with digestion. Thanks to you. Hopefully that's making a difference. And again, that's one step. That's one part of the process, but it can be really helpful. Some people, if that's not enough, you may need to take a step back and actually do some kill off. One of our favorite, Brittany, you can pop that oregano max in there, is oil of oregano, and that one, so if some people still have some bloating, still have some gas, some different things, take three times a day for one bottle of the oregano, and then bring in all these probiotic rich foods, or bring some probiotics specifically, and that can make a major difference. Tabitha, what about tonsil problems in kids? They want to remove my 6-year-old's tonsils. So again, just like we've talked about throughout this whole conversation, look at inflammatory processes, look for food allergies. I would take them instantly off gluten and dairy, even if you don't have a food allergy test or whatever. Just, that's inflammatory, it's mucus producing, it's going to cause more issues there. Look into any other, do they have sinus issues? Are there mold issues in your house? Start doing nasal sprays to do some kill off if there is mold. You've got to calm down that immune inflammatory cascade, and that's going to make a huge difference. So yes, it stinks, and nobody wants to take the tonsils out. Sometimes it's just a genetic thing where everybody's tonsils in the family are just gigantic, but usually there's some type of underlying inflammatory food type of a process. Courtney, good to see you. I've recently heard a lot of diabetic meds to help with weight loss. Okay, so yes, some people are being prescribed diabetes medications for weight loss, metformin, things like that. What I can tell you is that's not addressing the problem. And the other part is those drugs are not without side effects. If you guys saw my post a couple of weeks ago, new study shows that men that are taking metformin, one of the most common diabetes drugs, before conception, before they conceive with their wife, 40% increase in birth defects in those children of men that were taking metformin before conception. So they are not without concern. I absolutely would not go there for weight loss. I would fix the why. Remember, being overweight is not the problem. It is the symptom of ill health. So Olivia, Brittany's going to pop down the vitamin D that we use with our patients, a link for that one. What do you know or think of this to help control blood sugars with folks who need help? Here's the deal. I haven't given out a blood sugar supplement in months, if not years. And that's my whole shtick, right? I'm the blood sugar guy, and that's what we talk about all the time. Obviously, we do all kinds of other things, but blood sugar is a big part of our healing with our patients and with a lot of you guys that have been following me for years. You've started checking your blood sugar, you're thinking about cutting sugar out, all these things. But here's the deal. If you are still needing to take some type of a supplement, medication, anything like that, you did not truly get to what foods work and what foods don't. Unless you're just like a raging type 2 diabetic that their system is so far out of balance and you need some support short term. Even type 1 diabetics that are insulin dependent, we can get between 100 and 140 90% of the time with their diet. And so, yes, they're still on insulin, but they're taking less, and it's way more stable, and they're causing way less inflammation. So, Courtney, 99.9% of the people do not need to be taking those drugs. Fatty liver, I don't drink. How can I get rid of this fatty liver? Awesome. Fatty liver is something we kick out all the time, totally reversible. The liver, amazing organ. If I cut out half your liver, if I needed a liver transplant, it would grow inside of me, yours would grow back. if you have fatty liver, I don't want your liver right now, but give me 6 months and I would take some of your liver. It can heal that quickly. So fatty liver used to be from drinking, but now it's from those blood sugar swings. Liver stores glucose, liver kicks out glucose, stores it, kicks it out, liver, over and over and over. So especially people with these blood sugar swings, we see way more fatty liver from that than we do from drinking. So what do you need to do? Easy. Number one step is to stabilize your blood sugar. Grab my book, read how to stabilize your blood sugar, and you will see massive changes. Yes, Brittany can put down the liver repair powder. We can go through a cleanse. We can do some different things through there, but you've got to stabilize your blood sugar first, and you will see major changes. Julie, doctor thinks my granddaughter might have Marfan's. Can blood work be done? They want her to see a specialist, but haven't requested any blood work. Yes, absolutely. So no matter what is going on, the underlying whys with that need to be figured out. So running blood work would be a great place to start. Let's at least see what's out. Even genetic things, even if the doctor says, oh, this is genetic, well, guess what? Our genes don't have to express a certain way. People that have breast cancer gene do not have to get breast cancer. People that have certain genetics do not have to express those. If we can get the body as strong as possible, less likely for those genetics to go haywire. Christine, best treatment for highferritin, love it. Hey guys, anybody that's been following me, what's my number one favorite blood work marker to test? Ferritin. That's right. So ferritin is going to be stored iron. Stored iron low is going to be anemia, leaky gut, all that. But high, boom. 99% of the time, I know that if somebody's got high ferritin, they've got insulin resistance, they've got high triglycerides, they've got their inflammatory markers are going high, maybe some fatty liver, blood sugar swings, all these things. That 1%, it might be genetic and they actually do have hemochromatosis, but 99% of the people, it is because of these blood sugar swings and this inflammation. Stabilize that, get rid of the liver issues, and your ferritin will get back to normal. We see it all the time. So you can get that fixed. Jenny, can you reach natural immunity COVID if you take monoclonal antibodies? Great question. I don't know that answer. I have not seen a patient or know anybody that did the monoclonal antibodies and didn't get the infection. You know, they did the antibodies because they had an infection. So hard to say whether they had antibodies and immunity because of the monoclonal antibodies or because of the infection itself. So I have not seen that in the research. And all right, I got one more here, then I gotta jump. Okay, Hazel. Great to see you, Hazel. Is this your first video with us? Good to see you. What can I do about my gallstones? So gallstones, very not much fun. You know, can cause attacks, can cause irritation, a lot of yucky stuff. Remember that gallbladder holds bile produced from the liver, holds bile when you eat fatty foods, squeezes out, and then it helps break down that fat. But if you have gallstones, it's not going to work like it's supposed to. So what do we need to do? One, fix why you're making those gallstones. So you got to clean up your diet. You got to do all the things to really get it to where you're not going to make more gallstones. And then number two, you can do a purge, you can do a cleanse. One of my favorite is a beet cleanse where you take shredded beets, lemon juice, and mix that up and take a scoop of it multiple times a day. If you want to go extreme, you can do a full-on purge where you take olive oil. Some people use Coca-Cola in there, a lot of different things. If you just do a quick Google search on the gallstones. If somebody is like, they're going to take my gallbladder out in the next week, I would go ahead and do a purge and just see if you can get those stones out. Worst case scenario, and again, this isn't my medical advice, but it's what I would do. But worst case scenario, a stone gets stuck and you got to go to the hospital and they take it out early. But I would do everything I could to try to purge those stones out if you are going to be having it removed very soon. All right, I got to jump. Love having you guys on. So many questions. You can see so many health issues, but what's the philosophy that you have to get your life back? You have to figure out the why, you have to dig deep, you have to look at blood work, and then you have to work system by system by system and get that body where it needs to be. So hope this information helps. Again, check out the YouTube channel, almost 700 videos. Learn, learn, learn. If you need more help, we have F8 doctors around the country waiting to help you. And so we have a set number of appointments per week that we can help people. We're in the country, and yet if you need help, reach out. We're here for you guys. So stay strong, keep your bodies healing as much as feasibly possible, and we will talk soon. Take care.